Any concerns that bring you in?
I'm having a few weird feelings coming from my tummy.
Okay.
My scalp has been a little on the itchy side as well as my skin. And I've been seeing floaters in my eyes, which have been really bothering me lately.
Do you wear contacts or glasses?
No.
No. Okay. And when was the last time that you had an eye exam done by an ophthalmologist?
It was definitely about probably 8 months ago now.
8 months ago. And tell me a little more about the tummy problems. Have you changed anything in your diet? Anything that could be food related?
I'm eating dairy and I was vegan for about 1.5 years, so
Okay.
I think my stomach is just a little sensitive to dairy because I didn't have it in my diet for a while.
Got it, yeah. That could definitely be one of the causes. Okay, so I'm gonna go ahead and perform an abdominal assessment today, as well as an eye exam. And I'm also going to inspect your scalp and see if there's any skin-related problems that may be contributing to the sensations you mentioned.
All right, thank you. I appreciate you doing that. And would you be able to look at the soles of my feet? Sometimes when I'm walking, they feel a little, just, I don't know, not like they should be feeling.
Sounds good, I'll do that for sure.
Okay. Just a little bit of like a piercing feeling coming from like the middle of my foot.
Are you wearing high heels a lot?
No, but I have quite arched feet, and I think that I probably should be wearing something inside because the feet on the floor, they start to hurt for some reason.
Got it. I'll put on the medical gloves and then we can start the examination for today. Are you in any pain right now?
No.
Okay, any floaters?
I do have one floater. It's in this eye, and it'll go up, down, back, and forth. And then I do have a few light ones here. They get worse if I'm exposed to light. So I try to be as careful as I can. I was thinking about taking maybe some sort of like vitamin for the eye.
That could definitely help. All right, so I'm gonna go ahead and start by taking your vital signs. Have you had any flu-like symptoms in the last 2 weeks?
No.
No, all right, so I'm gonna take your temperature. 98.5, so definitely do not have a fever. Let's check the levels of oxygenation in your blood. You can slide your index finger in here. Perfect. And we can let this arm to rest. I can take the pulse over here. Okay, good, that's normal. Hand over your carotid artery. Compare it to the other one. Okay, so pulse feels quite normal when taken manually. 98% oxygenation and about 80 beats per minute. So no concern there with your heart. Let's go ahead and listen to your heart and lungs. You can just breathe normally. Okay, sounds are normal from your heart. I'm not hearing any extra sounds. No adventitious murmurs. Okay, take a deep breath in and out. Okay, lungs are strong. No crackling. No bronchitis. No wheezing. Okay. Good. Let's go ahead and take your blood pressure as well. Have you ever had this done before?
Yes.
Okay, so you know what to expect then. We're going to slide this here and cuff it. I'm going to place this here. And I'm first going to just check your pulse. Quite normal. Now I want you to raise your arm and pump your fist 10 times to recirculate the blood. Good, you can lower it. I'm gonna place this right here and place your arm right in between my arm and my body, and just relax. Okay. Gonna do this one more time. Hmm. 110/60, so you're a little bit on the low side. Are you feeling lightheaded right now?
I would say just a little bit.
Have you had any sugar in the morning?
I didn't. I'm sugar free today, so that could be the reason, maybe.
That may very well be, yes. Okay, so next up I'd like you to change in this gown and lay on the table face up. I'm going to take a look at your scalp, your head, your face, palpate your lymph nodes, and then I'll take a little peek at your tummy as well and your back, and we'll focus on the feet too. Thank you. Okay, Katharina, I'm going to go ahead and just inspect your face. Feel your thyroid, which is not enlarged. Can you swallow for me? Okay, good. Thyroid is mobile, moves up and down, and it's barely palpable. I'm gonna go ahead and feel the lymph nodes underneath your jawline. Starting with the submental and submandibular lymph nodes. Tonsillar. Parotid and the preauricular lymph node in the front of the ears. I'm not noting any enlargements. Okay, let's take a look at the cervical lymph nodes on the side of the neck. Okay, the deep cervical, superficial cervical and occipital in the back. That looks quite normal. Let's take a look on the other side as well. Okay, no enlargements noted. I'm gonna go ahead and apply a little pressure on your sinuses. The maxillary sinuses. The frontal sinuses, then the ethmoid, I'm not noting any congestions. Sphenoid, let's go ahead and tap. Good. I'm gonna go ahead and do a skin inspection. Not noting any moles, no patches of dryness or scaling. No ptosis or any abnormalities of the mouth area. The bridge of the nose is straight. Okay, let's take a look at your eyebrows. If you can move your head towards your right a little bit. Even hair distribution, no indication of any hypothyroidism, which could be accompanied by an uneven hair distribution in the eyebrows. Just checking your eyelashes for any premature breakages. Okay, that's normal. Let's go ahead and test the dermatomes on your face. And dermatomes are areas of the skin that are innervated by the same single spinal nerve root, and they are everywhere on your body. So we're going to do a test called sharp or dull. This is sharp and this is dull. Can you tell the difference?
Yes.
Okay, go ahead and say sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp.
Now I have here something slightly more dull and then something slightly more sharp. Go ahead and tell me, sharp or dull?
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, so I'm not concerned with the dermatomes of your face.
I just want measuring it.
I'm gonna go ahead and measure your face. I'm gonna go ahead and check the symmetry of your face as well and measure from the tip of the nose between your eyebrows and in between the beginning of one eyebrow and the end. Okay, your eyebrows are quite symmetric. Good. From the hairline to the tip of the chin, from the tip of the chin to the hairline on the right. Okay, from one ear to one eyebrow, from one eyebrow, one ear. Okay, good. So we are very symmetric. Okay, do you feel this?
Yes.
Okay, go ahead and say yes when you feel it.
Yes. 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 Yes.
Good. So not concerned with the dermatomes on your face. I'm gonna just take a little bit of the water off. It's just water. Okay, good. I'm gonna go ahead and inspect your hairline. And you do have quite a lot of baby hairs. I'm looking for any folliculitis, signs of alopecia, ringworm, dermatitis. Okay. The hairline looks quite normal. The well-distributed amount of hair that is not breaking or tearing apart when I gently touch. No moles. Okay. Go ahead and brush your hair and inspect the scalp a little bit more in depth. Okay, you have a very clear scalp, not noting any dandruff. No signs of any skin diseases or abnormalities. I'm gonna go ahead and part your hair here. And do you feel that?
Yes.
Okay, we're gonna do the same sharp or dull test. Can you tell me if this is sharp or dull?
Dull.
Good.
Sharp. Dull.
Okay.
Sharp. Dull. Dull. Sharp. Dull.
Let's take a look at the top of the head as well. Sharp or dull?
Dull. Oh.
Sharp or dull?
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull.
Do you feel that?
Yes.
And that?
Yes.
That?
Yes.
Just say yes when you feel it.
Yes. Yes. Yes.
Now I have here a device with 2 pinwheels. Go ahead and say 1 or 2.
2. 1. 2. 1. 2. 2.
Okay. I'm gonna go ahead and measure your scalp. I'm going to inspect your scalp next with my chopsticks. I'm going to go a little bit deeper with the scratching and see if there's any flakiness that we should be concerned about. It's in the back of the head as well. If you can move your head towards your left. Okay. Alright, Catherine, I'm gonna go ahead and unbutton your gown if that's okay with you.
Yes.
Okay? I'm going to expose the abdomen and perform an abdominal inspection of the exterior abdominal cavity as well as of the interior organs. Okay. Going to begin by auscultating first. You can just breathe normally. I'm hearing a normal activity in all four quadrants of the abdominal cavity. No gurgling or swooshing sounds. Just normal bowel movement and sounds indicative of a healthy abdominal cavity. Okay. Going to do a light palpation. Just check the size of your internal organs. Feeling the tip of the liver, which is not enlarged. Good. And the spleen. Okay, normal. And the stomach. Okay, a little bit deeper. Okay, good, not enlarged. All right. I'm going to check the dermatomes next. And we're going to do the same sharp or dull test that we did on your face. This is sharp. And this is dull. Can you tell the difference?
Yes.
Okay, go ahead and say sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Dull.
Okay, now I'm going to slide down my tuning fork on the abdomen next. It's a little cold. Go ahead and tell me when you stop feeling it.
Now.
Okay.
Now. Now.
Good.
Now.
Good. Okay. I'm going to spray you with a little water next. Go ahead and say yes when you feel it.
Yes. 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 Yes.
to measure the body fat percentage next. And I'm going to measure your belly button as well. Good. You have quite a symmetric abdomen. Good. Right, I'm going to do a little tapping and check the resonance. Good. I'm hearing the right level of dullness coming from the internal cavity. And I have here a tool that has 2 pinwheels. I'm going to touch you with 1 or 2. Go ahead and say 1 or 2.
1. 1. 2. 2. 1. 2. 2.
And is it sharp or dull?
Dull.
How about this?
Sharp.
And that?
Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull.
Alright, I'm going to go ahead and button your gown. And let's have you flip over so I can take a look at your back. Alright, Catherine, I'm going to go ahead and unbutton your gown. And expose your back, and we're going to do a medical examination of the back and spine. Okay. Right. I'm going to begin by listening to your lungs first. Check the base of the lungs. Take a deep breath in. And out. Okay. Deep breath in. And out. Okay, good. So lungs sound clear. No signs of bronchitis, infiltrates, pneumonia. Okay. I'm going to check the dermatomes in your back, and we're going to do the same sharp or dull test. Do you feel this?
Mm-hmm.
Okay, and this?
Mm-hmm.
Can you tell the difference?
Yeah.
Good. So go ahead and tell me sharp or dull.
Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
Okay. And I have here a cold and a dull object. Go ahead and say cold or dull.
Cold. Dull. Cold. Dull. Cold. Dull. Cold.
Okay. Go ahead and tell me when the dull sensation stops.
Well.
Good.
Well.
Good.
Yeah.
And how about when the cold sensation stops?
Yeah. Yeah. Yeah.
Good. Okay. Just say yes when you feel the sensation.
Yeah. 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 Yeah.
Okay, I'm going to check the body fat percentage on your back. Okay, as well as checking the back symmetry. I'm gonna tap on your back next and relax the muscles a little. Right, I'm going to unbutton your crown and then I'm going to inspect your legs and your feet. Is it okay if I remove your socks?
Yes.
Okay. And I'm gonna go ahead and measure your feet first. 50, 50, 52, 52. And I'm going to measure your toes. Okay. Right. And the other one. Good. Good. So your toes are very symmetric. I'm going to go ahead and just pinch on the skin and check for any edema or lack of symmetry. Okay. And from the top of your big toe, up quite symmetric, across your plantar region. Symmetric, yep. And at the top of the calcaneus region, we have a little bit of an asymmetry. Yeah, a little bit of swell increase of the calcaneus region here. Okay, do you feel that?
Yes.
And that?
Yes.
That?
Yes.
That? Okay,
Yes.
good. I'm gonna go ahead and test your toenails. For any dermatitis. Okay. Okay. None is present. Go ahead and wiggle your toes. Okay, very good. Going to palpate the plantar region and calcaneus arc. Any pain here?
No.
Okay, good. Is it sharp or dull?
I couldn't really feel it.
Okay, let's try again.
Sharp.
Good.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull.
Okay. Tell me when you stop feeling the sensation.
No.
Okay.
No. No. No.
Good. Okay, Katharina, I can come back up now. All right, Katharina, I did a very thorough inspection of your whole body. The women's health examination today is very positive. I'm not finding anything abnormal with you. You are just perfect.
Well, thank you.
Do you have any questions for me?
I do not. Maybe just if you have any recommendations for the floaters.
Definitely invest in a good pair of blue light blocking glasses. You can take them from the pharmacy, you can order them online and make sure that you wear them every day.
Okay.
Stay away from electronics at night. Avoid any powerful lights shining right into your eyes. Try not to drive at night. If you ever do that, don't use your car at night because the flashlights from the other vehicles can really be blinding.
Yeah, I'm definitely sensitive to that. Thank you so much.
You're most welcome. I hope to see you again soon, but not too soon.